WHO, known as the World Health Organization, has just issued a warning about the monkeypox disease. They're saying that the situation constitutes a public health emergency of international concern. Let's see what they have to say.
MPox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of MPox in eastern DRC, its detection in neighboring countries that had not previously reported MPox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of MPox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Now, we should all be skeptical about this, and we should all question the authenticity of this. And what I mean is this: we should be asking ourselves, is this a true outbreak, or is this something planned and orchestrated by those in charge? In 2022, they promoted a monkeypox outbreak, but then quickly decided not to push it anymore. Is this the same situation as that, or will they be going forward with this one?
There are growing questions today around a new and deadly outbreak. Scientists determined that this monkeypox virus was engineered. With limited antiviral drugs and no known effective treatments, countries around the world are struggling to control another pandemic with already devastating effects.
Seeing far fewer cases in countries where governments took early and decisive action.
And some international experts are urging the WHO to adopt a phased approach to warnings.
We all know monkeypox is a serious disease, but is it biological warfare at this point? Are we going to relive the 2019 pandemic all over again? Is this what they are trying to push? I don't think it's just coincidence. We should all find it odd that this again is happening around election time. It seems like every year, every election year, there seems to be some sort of breakout that happens. Doesn't this whole thing seem real familiar?
We do need more money, but we don't just need more money for vaccines for children eventually. We need more money to plan for the second pandemic. There's going to be another pandemic. We have to think ahead. And that's not something the last outfit did very well. That's something we've been doing fairly well. That's why we need the money.
As I always say, this is just another means to pave the way to have everyone on one accord, aka a new world order, a one world beast system. 2019 was just a foreshadowing of what's to come. It was a test to see if they can have everybody on one accord under one rule, and it worked out for them good. A pandemic is a great way to scare everyone into compliance, to strip us from our laws and freedoms. These pandemics are prepared way ahead of time. Let's listen and hear what Bill Gates has to say.
Are we doing things now, or rather are we not doing things now that we really need to be doing in preparation for the next pandemic?
We are ready for the next pandemic, but it'll take tens of billions in R&D that the US and the UK will be part of that. It'll take probably about $1 billion a year for a pandemic task force at the WHO level which is doing the surveillance and actually doing what I call germ games, where you practice. You say, okay, what if a bioterrorist brought smallpox to 10 airports? You know, how would the world respond to that? What if a bioterrorist brought smallpox to 10 airports? A bioterrorist brought smallpox to 10 airports.
A bioterrorist brought smallpox to 10 airports.
So we, we'll have to prepare for the next one. That, I'd say is will get attention this time.
Look at their sinister smirk and smile as they say the next pandemic will get everyone's attention. I tell you, these people are wicked. They always talk about a new world order. They always talk about a great reset. They always talk about reconstructing the current world that we're in. WEF's World Economic Forum's founder, Klaus Schwab, confirms this. Listen to what he says.
The COVID-19 crisis has shown us that our old systems are not fit anymore for the 21st century. We need a great reset.
History is truly at a turning point. We do not yet know the full extent and the systemic and structural changes which will happen. However, we do know that global energy systems, food systems, and supply chains will be deeply affected. In times of crisis, the role of governments is more important and more relevant than ever. What is also needed is a summit like this one to go beyond crisis management and to look into constructive ways we can build our common future. Our futures are intrinsically connected to one another, as the profound challenges to mankind, such as climate change, are globally interconnected and require collaborative responses. In conclusion, and despite all the challenges, we have to uphold our responsibility, which we have towards the next generation, and which we can only fulfill through collaboration on a national and on a global level.
Will this monkeypox be bigger than the pandemic in 2019? We'll just have to wait and see. These things aren't conspiracies. This is Revelation 13, and it's coming. Saints, buckle up. My name is Darius Giles. This is JCITB-TV. I'll check you next time.
Free fries when you get vaccinated? I got vaccinated. You're saying I could get this? These delicious fries? Wait a minute. But there's also a burger element to this?
JCITB